Yeah, thank you. Hey, Miss Smith. Hey, my name is Chad. I'm going to be your nurse today. Man, these donuts. Okay. Now, I guess you were complaining about maybe some heart palpitations or something. I just talked to the nurse out there, and can you just tell me what's going on here so we can see where we're going with this?
Yeah, so I came in with some complications yesterday, but before we go any further, I'm really sorry, nothing personal, but from my religious perspective, I would prefer a female nurse to be taking care of me today.
Well, I mean, yeah, like I mean, there's gonna be a lot of nurses taking care of you. I'm gonna be your main nurse. Can you just tell me, you know, the problems we're going with, and because I mean, we're really busy right now, and I
Nothing personal.
No.
I just can't have a male nurse take care of me today.
Okay. Let me talk to the doctor. Let me talk to some people, and we'll see what we can do.
All right, thank you. No, it's not the
Hey Florence, how's it going?
Okay.
Not a whole lot. Just, you know that room that I just got assigned, 138.
Yeah.
There's some Miss Smith is her name. I don't know. She's being kind of cranky. Something about heart palpitations and stuff. Do you mind if we switch? She's got some religious thing that she's doing or whatever. She doesn't want to deal with a male, so I don't want to deal with this stuff right now. Can we switch patients?
Yeah, I mean,
Well,
that's fine.
we can get it. We'll get it cleared with the
Yeah.
head nurse.
Yeah, so did you already talk to them though about it? About switching?
Yeah.
Yeah, sounds good. Okay. Alright, then we're good.
Come in.
Hi, my name is Florence. I will be your nurse today. Let me just go and wash my hands real quick, okay?
Yeah, sure.
So I do understand that my coworker was somewhat not
very friendly.
Yeah, with you guys, so I do want to apologize for that. And so I was reading your admission report down at the nurses station, but I would like you to just go through it all with me and let me know what was that happened and brought you here today.
Sure. So I came in yesterday and I had some heart palpitation. I was feeling very anxious and I was kind of throwing up before I came in. So I really don't know what could have caused that.
Mm-hmm.
Yeah.
Do you guys live together?
Yeah, I'm her sister.
Oh, okay. Maybe you've noticed any changes in her behavior or demeanor or any...
Well, just the other day with her symptoms she was having, but I do remember that we started taking these new herbal supplements and this new herbal tea that we've been drinking a few times a day. I think she might drink it more often than I do.
Okay.
And since her symptoms just started a couple days ago, maybe I'm thinking she might be having some type of reaction to this new supplement.
Do you know about how much you were taking?
Well, there are no specific instructions on it, so I was just taking it as many times as like five times a day.
Okay.
Yeah, with pretty much every meal or snack.
Okay. So was this tea prescribed to you?
No, actually, we were just looking it up online, me and my sister, and decided to purchase it on Amazon. I think it's in my purse. Do you want to reach out and see? I always carry it with me. Yeah, here we go.
Okay. Well, would you mind me taking this back to, doing some research?
Yeah, that's fine.
Okay. All right. Before I leave, I'd like to ask if there's anything I can do for you today, before I walk out or by the time I come back in, I just want to make sure I make you feel as comfortable as I can.
Yeah, sure. as in for now, we're doing good. If I need your help, we'll call you back. Thank you.
All right, thank you.
Thanks.
Hey Joe, could you come here real quick? I just want to have a quick conversation with you.
Yeah, sure, no problem.
If we can. So I just wanted to talk about how we, exchanged those 2 patients.
Yeah, that was awesome. Thank you. I want to let you know that I really appreciate that. 131 is way easier than 130. I didn't even want to deal with that.
Mm-hmm. Well, I kind of want to make it clear that I did not decide to switch patients for you. It was more to accommodate the patient, because we are here in reality for the patients, We're not just here for a paycheck. I went in there. I didn't have this conversation with you before because I really felt like it was critical for me to get in there with the patient and apologize, because I do feel like it was you discriminating against her religious beliefs. Even if you don't agree with it, you should still accommodate them.
Yeah.
Remember, this is like their second home, So you have to understand that, once they're in there, it's their home, and you have to knock that door, on that door like if it was their home, and respect that, and respect whatever they believe, Remember when we were in nursing school, remember that HPR class where
Oh my gosh,
where we learned
yeah.
about professionalism,
Bless
core
you.
values, and everything. I feel like you've kind of lost track of that. And this is not me talking to you as your lead nurse or anything. This is me talking to you as your coworker and, a friend that feels like you're kind of getting away from the goal that we once set.
I do remember that HPR class.
Yeah, remember how it was all about communication and teamwork and, the patient and
Patient-centered care.
Yep, and caring. And I feel like maybe you're burned out, Remember that article? Yeah. Maybe that's what's happening right now, Maybe you reached your burnout session.
Maybe I should open up some of those papers and emails that Benini sent us.
Yeah, of course.
All right.
All right, well,
Thank
nice talking to you. Hopefully it changes, okay? And understand we're here for the patients, okay?
you. All right.
Hey, Dr. Love, do you have a second to talk about
Yeah,
the
what's
patient
up?
real quick? So, here's the situation. So today, Miss Smith was admitted to the emergency room because she had palpitations, pale skin, and signs of anxiety. That's how she described it. She felt like she was having an anxiety episode. She says that she had a really bad headache and had vomited before coming to the hospital, and said she occasionally felt like she was going to faint. This is the first time she's ever had this happen to her. I guess she started taking some tea, and I did my background on that, and I actually emailed it to you. I don't know if you pulled that up,
I haven't checked my email yet, but let's see. Yeah, I did get it.
Okay, yeah, so that's just basic, real quick information about the tea. So I'm pretty sure what happened is she overdosed. You're only supposed to do like a couple teaspoons, and she went ahead and did the whole bag, and was drinking a lot too.
Okay.
She was drinking it 5 times a day, as opposed to her sister, who was only taking it once or twice a day, and she feels just fine. So I'm thinking it was more of an overdose. So I don't know if you want to put her on medication or what you want to do.
Yeah, well, I mean, the symptoms sound like anxiety, but if this tea is being added into the diet just recently, it sounds like that's it. So I think what we just need to do is have her come off of the tea for a couple days and see if that helps.
Okay.
And then tell her the dosage of the tea.
Okay, so explain it to her, go over that with her.
Yeah, if you wouldn't mind doing that for me, and maybe I'll look at this and we can give her a handout for this tea too,
Yeah.
so she knows how to use it.
Okay, and I'll have her scheduled for an appointment maybe in a couple days just so she can come back and we can make sure she's okay. Is
Yeah.
that okay with you?
Yeah, that's fine.
Okay. All right, well, thank you.
Come in.
Hi, Miss Smith.
Hi, Florence.
Hi, how are you feeling?
Better.
Better? All right, so, my shift is about to come to an end. So I just wanted to bring in your night nurse. Her name is Amy. an exceptional nurse, you know, and I just want you to know you're in very great hands. And I wanted to bring her in the room and, you know, go over where you're at right now and just all of that. So, Miss Smith came in today with heart palpitations. Her heart rate was extremely high, and so her sister mentioned that they have started a new like herbal supplement, you know, teas and stuff. And apparently her sister is taking them, but way less, like once or twice a day, as opposed to Miss Smith, who has been taking it about 5 times a day. So thankfully, as you can see, like we've managed to keep her vitals
Pretty
steady.
normal right
Yeah.
now. Okay.
So just real quick, I did talk to the doctor, and we sat down and we assessed the whole situation. So later on, Amy will bring in some paperwork, you know, your discharge paperwork, along with just, you know, a little bit of instructions as how to take the tea if you want to continue taking it later on. But first, you know, we want to take some time off. But she'll discuss that with you, you know,
Okay,
once the paperwork is all typed up and we get it back from the doctor, okay?
Great.
Miss Smith, is there anything you'd like to add or let her know?
No, I feel much better today. Hopefully I can be discharged tomorrow.
That'll
Yeah.
be our goal.
We
Alright.
appreciate your time.
Oh no, you're welcome. It was a pleasure taking care of you today.
Thank you.
All right.
Let me know if you need anything.
All right. Bye.
Hi, Miss Smith. How are you doing?
Doing better.
Better? All right. Well, I got good news. We're going to discharge you.
Great.
So here is all your paperwork that you're going to need.
Okay.
All the information you'll need is on there. I made you an appointment with your primary care doctor to follow up in a couple days.
Okay.
All right? Make sure everything's okay.
Great. I just had a question
Yeah.
about the name of this procedure or like aftercare. I don't understand it.
Oh, just ask your doctor when you go to your appointment next week. He'll be able to explain it all for you. All right?
Okay.
Okay, you're
I
free to
guess.
go home. Have a good day.
Thank you.
Hi, Miss Smith. Good morning.
Hi.
How are you?
I'm feeling much better. Thank you.
Good. All right, I got good news. You get to go home today.
Great.
So I've got all your discharge paperwork here. So after speaking with the doctor and the nurse last night, Florence, we kind of just came up with the plan of having you stop the herbal supplement that you were on because we think that the anxiety that you were kind of feeling was a side effect of that
Okay.
tea. So since it was new in your diet, we're going to have you stop it for a couple of days. Since you are a patient of the clinic downstairs, I do advise that you follow up with your primary doctor.
Okay.
That way you can kind of just reassess at that point, make sure once you're off the medication, or the tea rather, that you're doing a lot better. If anything gets worse, we obviously want you to come back.
Great.
And then I have all of your discharge paperwork with everything that we did. So here's
you.
this for you. Is there
That
any other
sounds reasonable.
questions?
No, that'll be it. I'm glad you guys figured it out, and yeah, I really enjoyed my experience with you guys today.
Thank you. We appreciate that.
Yeah,
All right.
of
Take care.